So, I've been working 48-hour weeks, and I'm pretty sure I contracted the flu. So, as much as I really don't want to make a sad, depressing video like this following the holidays, in fact, it's YouTube, I should really be doing a holiday special. I'm sick, overworked, and I feel like shit. So, this video is going to be about being sick, overworked, and kind of feeling like shit in some way. This is hypochondria with dyspraxia. Hypochondria is defined as having psychosomatic symptoms with seemingly no cause, typically as a result of going to medical school or watching a lot of medical documentaries or just in general having some sort of anxiety around medicine. And because of that, many individuals will go and seek help or may avoid seeking help because they've been denied so many times. It's kind of somewhat of a stereotype, and people like to use the term for people who constantly say they're sick when they may or may not be. But there's a severe distinction to be made here, because there's a difference between hypochondriasis and something commonly known as Munchausen syndrome. Most people like to use these terms interchangeably, but they don't mean the same thing. Munchausen syndrome is when somebody knows that they're not really sick and they go out of their way to get attention from a medical provider or anything. And like I said earlier, many hypochondriacs will actively avoid going to the doctor until the very last minute because they don't know for sure if their symptoms are psychosomatic or not, and they've been turned down so many times by doctors. It's important to make a distinction between people who are actually hypochondriacs and people who are jokingly or commonly called hypochondriacs. See, because hypochondriac is a term that's commonly used for many people who may think they have something worse than they actually have, or are typically accused of such. Someone who's actually suffering from hypochondriasis will have legitimate symptoms despite the fact that they're psychosomatic. Essentially, the brain is subconsciously convincing itself that it has a serious problem, and most hypochondriacs aren't going out of their way to diagnose themselves, and many of them, like I said earlier, avoid treatment simply because doctors will keep telling them there's nothing wrong with them when to them very well may feel like it, and their symptoms will reflect as such. And this can cause a lot of confusion when they see doctors, because the symptoms are there and they are showing, but the doctors just can't find a cause. And it's actually been theorized that some IBS sufferers are actually suffering from severe hypochondria, hence the real symptoms of constipation and diarrhea. Hypochondria seems very prominent in those with neurodevelopmental disorders too. And that's important to delineate as well. I think a large part of it also comes from the fact that many of us are really prone to getting sick. Simply put, with dyspraxia, once you feel something, you feel it hardcore, you feel it all the way. I've actually discussed this in length in the Feeling with Dyspraxia video. So even if you have something minor like the common cold or even just a stomach bug, it's gonna affect you and you're gonna feel it so hard that it'll feel worse than any kind of common cold or stomach bug that most people will feel, especially if it's a strain that's particularly bad and causing numerous amounts of nausea and vomiting. And after a while, the recovery period usually takes longer too, because, well, dyspraxia, you're feeling it harder and there's a lag between when you actually feel better and when that feeling of feeling better actually hits you. This is why typically, at least in my case and many of the cases of my friends, hypochondria tends to start after a significant illness or seeing someone with a significant illness. It's easy to draw the correlations, and once you have yourself convinced that you have something, you're going to start feeling like you have it. It's also important to note that many of us dyspraxics don't like to get help with things. We want to believe that we're super independent and that our limitations just don't exist, or we can overthrow them. But the thing about having a disability is acknowledging that yes, you do have limitations and you do need to get help. But due to this lack of seeking help, many of us eventually get really, really sick. See, the thing to keep in mind is even with a common cold, you still risk suffering pneumonia. And with even some of the simplest things, you could risk pneumonia. And pneumonia is something serious that can have you hospitalized and even admitted for a couple of days to even a week or two. So it's always important to at least see a primary care physician or even an urgent care when you're starting to feel sick enough that it is affecting your day-to-day life. Getting that help is a lot harder than it seems. And listen, I'm all for independence and fighting your limitations as much as you can. I think we're all incredible people who do amazing things. We do amazing things every day. Again, I mean, I bring it up a lot, but Albert Einstein has been theorized to have at least dyslexia, if not dyspraxia. And many dyspraxics go on to be famous actors. I mean, who else do we know better than Daniel Radcliffe? But at the same time, nothing is worth losing or risking losing your health over. This is in part why primary care physicians exist. In theory, you're supposed to see your primary care physician at least once a year for your yearly physical, and you're supposed to regularly see them when you feel sick. Problem is, here in the US, healthcare isn't easy to come by. And we can have a whole debate about healthcare, and honestly, I'm way too sick to even discuss healthcare. I think I went about it in length in another video. Maybe I'll do a blog channel too, where I discuss political shit, but I try to keep this channel as informative as possible. So I'm gonna avoid having a little debate about that and just discuss a little bit about the importance of having a primary care physician. See, one of the most important aspects of the primary care physician is that it maintains a doctor-patient relationship. Something I always say about not diagnosing yourself is because you don't have the necessary medical context. You can go on WebMD or go to the ER whenever you want, whenever you feel sick. You could even do your own research online like I do with my videos. But the thing is, none of that information is meant to pertain to one's everyday life. It's more of a resource that one can learn from, and one can get some kind of idea of how severe their symptoms are. But at the same time, it's not a replacement for a diagnosis. Your doctor-patient relationship with your primary care physician is supposed to include your day-to-day life, or at least your doctor having some idea of your day-to-day life and how certain treatments will and will not affect your day-to-day life. It's because of this that your doctor is usually the primary person who will be prescribing you medication unless it's for an emergency or something simple like the flu. And even then, if you're taking Tamiflu but you're working a certain amount of hours, you probably shouldn't be taking Tamiflu. You should probably be taking a couple days off and hydrating, especially once you're past the 2-day mark. But I'm not a doctor and I don't know you personally, so I can't tell you exactly what treatment you should take for whatever you're suffering with. That should be someone who has some idea of the context of your day-to-day life, on top of your medical history, on top of a sizable amount of medical information on how to apply that medical information to your day-to-day life. At least here in the US, your doctor is usually the first person to give you one of them bathroom cards too, for individuals with IBS who need to use the bathroom all the time, and no matter what the limitation. And so usually what they'll do is they'll give you this card that says you can use the bathroom anywhere, even if it's not an open restroom. Also here in the US, where we have legal cannabis, and that seems to be a common trend I talk about in these videos, but I'm really not as much of a stoner as I purvey myself as, I promise. But typically it's your doctor who will make that decision as to whether or not you get a recommendation for a medical marijuana card or not. And there's a reason your doctor is responsible for all these important aspects of your daily life. It's because they should know. Ironically, despite how much I push the information and diagnostic crap in this video, I still get asked regularly, both on Discord and on Reddit, about drug suggestions, treatment suggestions, or if someone may or may not have this or that. I tell everyone the same thing. I am not a licensed medical professional, nor do I claim to be. That is up to your doctor to make that decision for the reasons I laid out in this video. Many people who know me personally know I am going to school for pharmacology, which means my specialty is somewhat in drugs, but at the same time, drugs affect everybody differently in different ways and to different extents. And while most drugs do have somewhat of an index of subjective effects that you can read from, they are just that, subjective, and open to various different aspects of one's day-to-day life. While someone may take a drug and see certain effects, others will take a drug and see little to no effect. And they may see similar symptoms, but usually as the result of something else entirely going on in their life. And so even if someone is an expert in something like drugs or something like healthcare, they really can't help you unless they have the necessary context. So if you have any questions pertaining to your health, any treatments you take, or any drugs you're looking to take, the person you should talk to is not a YouTuber who works at a gas station or even a pharmacologist, but your doctor, your primary care physician. And yes, they may get on your ass a little bit about taking certain recreational drugs. They may get on your ass a little bit about your life not being the way it should be. You know, maybe you're not living the most healthy life or whatever, but they do have your best interest in mind, contrary to popular belief. If you see your doctor on a regular basis, on an annual basis, it doesn't matter how sick you are, they're still making money. There's this weird situation where people are convinced that doctors profit off of people being sick. That's not true. A doctor's job isn't just to treat sick people, although that is a large part of their job. A sizable amount of their job is preventing sickness to begin with. That's why vaccines are so important. I'm not going to sit here and lie and say there's no corruption in the medical industry at all. There's corruption everywhere, in any industry whatsoever. But that doesn't change the fact that your doctor has your best interest in mind and probably knows your body even better than you do. Even if you have your own medical degree, which most people with medical degrees wouldn't even think of diagnosing themselves, because it's important to remember that when you're looking at yourself, you have a bias. You do have a significant bias, preferably towards yourself, or if you're really, really depressed or really self-conscious, then maybe against yourself. Your doctor is an objective eye that has context. They legally have to be objective. So see your doctor. Even if you are a hypochondriac with dyspraxia, your doctor will be able to tell you exactly what you need to take, whether it even be a placebo in some situations, but your doctor will also be able to tell if something is actually wrong with you or if it is psychosomatic. And if your doctor can't, then he'll refer you to a specialist that can. And I feel like I'm preaching to the choir here because I know many of my subscribers are really smart, but this stuff does need to be said and does need to be passed on. Thanks to the internet, a lot of people distrust the medical industry, and it's not fair to the medical industry, nor is it fair to your body. If you really do have a doctor that's being that much of a dick to you, find yourself a lawyer. Alright, if you really have a doctor that really doesn't have your best interest in mind, find yourself a lawyer who's an expert in medical advice, because medical malpractice pays really, really well. But WebMD isn't your doctor, I'm not your doctor, and neither is Reddit. Sorry this video came off as preachy or kind of bitchy. I'm really sick right now, if you can't tell. And, you know, as much as I really don't want to leave this on the sour note, I'm going to wish everyone a happy new year watching this. I hope you guys have a good one, and just be safe and take care of yourselves, please. I love you guys.